तो पीसीओडी होता क्या है?
Multiple cysts is formed inside and they don't get the menstruation naturally.
पीसीओडी तो पता चल गया, इट इज अ डिसीज। ये पीसीओएस होता क्या है?
Group of symptoms is called as an PCOS.
Why does it actually happen? Why should a woman go through all that?
Lifestyle changes is the main thing for the PCOS.
ज्यादातर लोगों को नहीं पता कि ये नॉर्मल कैटेगरी में होता क्या है।
Anything before 25 days is not a normal cycle and after 35 days is not a normal cycle.
मुझे ये फैक्ट बहुत अच्छा लगा कि सिद्धा में साइड इफेक्ट्स नहीं होता है।
It's like similar to Ayurveda. It's more ancient than Ayurvedic medicine.
Obese, pigmentation, and extra hair growth. All these are only symptoms of PCOD.
These are the common symptoms. If they have the problem, they should not go directly to the hormonal medicines.
When a couple gets married, they don't want the baby and they are like, ठीक है, एक पिल ले लेते हैं, हो गया खत्म।
Some couples they do this mistake. Even they do multiple of time.
सिर्फ उन्हीं को इनफर्टिलिटी होता है।
PCOD is not only the reason for infertility.
नमस्कार, मैं हूँ एकता और करती हूँ आप सभी का तहे दिल से स्वागत आज के इस बहुत ही महत्वपूर्ण टॉपिक और डिस्कशन में। आज का जो टॉपिक है वो पीसीओडी से रिलेटेड है और आजकल जो हमारी लाइफस्टाइल चेंजेस हो रही हैं जिसके वजह से बहुत सारी महिलाओं में इनफर्टिलिटी के इश्यूज भी हो रहे हैं। तो आज का जो डिस्कशन है वो उसी के बारे में होगा, तो स्टे ट्यून्ड क्योंकि आज मेरे साथ जो बैठे हैं वो साउथ के बहुत ही जाने माने सिद्धा डॉक्टर हैं। काफ़ी ज़्यादा सक्सेसफुल रेट है इनकी और हर किसी प्रॉब्लम का जड़ ये ऐसे निकाल देते हैं। तो ज़्यादा वक्त नहीं लेते हैं यहाँ और बात करते हैं डॉक्टर गुरु के साथ। तो डॉक्टर गुरु कैसे हैं आप?
फाइन, अच्छा है।
अच्छा है। सो डॉक्टर गुरु, सबसे पहले आपकी जर्नी बताइए, सिद्धा में आप कब आए और कैसे आपकी शुरुआत हुई?
Like my family is a traditional background. Like we treat like from ancient times. Like traditionally we follow the Siddha medicine. Like mostly they don't know what is Siddha. In South India we know what is Siddha medicine, but not they think that it's like new what is Siddha. They don't know. It's like similar to Ayurveda. I can say it's more ancient than Ayurvedic medicine.
Oh.
Yeah, Siddha system of medicine, even the way we treat, it's a similar. Like mostly the Ayurveda and Siddha is similar medicines only will be there, but the formulation, everything will be same, but the medicine name will be different. But in Siddha, we do treat the root cause.
So doctor, very interesting experience of yours. तो आगे बढ़ते हैं। I want to know PCOD is our main topic for today and infertility as well.
Yeah.
तो PCOD होता क्या है?
Like PCOD is a polycystic ovarian disease that everyone knows. They just Google it, they can find.
They can find out.
Yeah.
Yes.
But what is PCOD? What happens in PCOD is that like every month the woman when they menstruate, the quality of one egg will be released. If they didn't get conceived, their eggs will be released as the menstruation cycle. Once they get the PCOD, the multiple cysts is formed inside and they don't get the menstruation naturally. And the day by day, what will happen is that they'll get the overweight gain, or like blotting will be there, and the cycles will not be regular. And once they get these symptoms, then it occurs the hormonal imbalance. Androgen levels will be more in the body. And once the androgen level is more, that is testosterone is related to testosterone, male hormone, when it increases, then they'll get the acne, extra hair growth, male pattern baldness, and they'll lose hair and pigmentation in cheeks, like external like skin. And they don't like if they treat also, they'll not be getting cured for that. And if they do use any creams or any treatment also, they'll not get the result. Then we can find out that they may have a PCOD, and if they get a USG ultrasound down, then you can find out they have the PCOD or PCOS.
ओके। तो पीसीओडी के मेन सिम्टम्स यही हैं कि ओबीज हो जाते हैं लोग और इसके अलावा पिगमेंटेशन शुरू हो जाती है एंड टेस्टोस्टेरोन जो है वो भी महिलाओं में ज़्यादातर पाया जाता है बट एक बैलेंस लेवल में। तो अगर वो उस बैलेंस लेवल से थोड़ा ज़्यादा हो जाए तो एक्स्ट्रा फेशियल हेयर,
Yes.
फेशियल हेयर में इवन द बॉडी हेयर,
Yes.
हाँ,
Even
it
some
grows.
women they get the facial hair, even the chest hair, even like they don't like if they do whatever the laser treatment. they'll get it again, no results for that. So if they get these symptoms, they should be first check the menstruation cycle. Then if the menstruation cycle is not regular, I suggest they should done USG ultrasound, and they should find if they have any cyst or any problem in their
प्रॉब्लम इन
uterus.
दैट।
Yes.
ठीक है, तो डॉक्टर पीसीओडी तो पता चल गया इट इज़ अ डिसीज़, ये पीसीओएस होता क्या है?
Like PCOD and PCOS is similar. Like PCOD is that when the egg is not able to come out, like through the cycle, then it is called as a PCOD. It is considered as a disease. Recent days, it is a group of symptoms they get, like how I say, like before, like they get the excessive weight gain, like male pattern baldness, hirsutism, like extra hair growth, like uncontrolled weight gain. So like this, if they get the symptoms together, then it is considered as a PCOS. Like group of symptoms is called as a syndrome. Yes.
फ्रॉम ओके, गॉट इट। तो डॉक्टर आई वांटेड टू चेक विथ यू कि पीसीओडी, पीसीओएस होता क्यों है? व्हाई डज़ इट एक्चुअली हैपन? व्हाई शुड अ वुमन गो थ्रू ऑल दैट?
There is not a particular reason for it. Some say it is a hereditary, or some they think it's a lifestyle issue. But according to me, recent days, women, if they don't get the menstruation, they just directly start some hormonal pills to get the menstruation
हाँ,
cycle.
येस दैट्स वेरी
Yeah,
कॉमन
in
दीज़
the
डेज़,
young age
येस।
itself, once if something like if a one cycle is missing, then they start the hormonal pills. That is only the problem starting. Like once they take those hormonal pills or 21 days pills or something like that to get the menstruation, they are forcing the body,
हुँ,
they're forcing the
हुँ।
body to get the cycle. Though that is a problem mainly the women are facing these days. That should be avoided, and they should try to change their lifestyle changes. Like what issues they have, they should just alter a little bit, like sleep or food habits or stress level or any physical activities. They don't, if they
They
don't do,
don't
they
do
should
anything,
start.
they should start.
Yeah, because in Purana times, they everyone like work out, like everyone they do their work by their own. Even the women, they go to the field. Even there was no mixie or anything, they go to the field, they cultivate it, and they come and they grind it everything by hand. Or even the chutneys they make or any masalas they make, they grind it, sit and grind. So when they sit and grind, the abdomen also will work. Actually, they no need before in ancient time, they no need to do any workout. The daily
उनका डेली
activities,
रूटीन ही हाँ,
yeah, daily activities was a physical exercise for women. But recent days, it's like changed completely. They just go sit in the office. They come back. They get more stressed in the office by the like work pressure. Yeah, and they just come. Some women with the more stress, they overeat also. Normally they don't they eat normally, but when they get overstressed, they get cravings, like they order some pizza, they finish it in whole also. Some women, when they get angry, they eat more. So that all should be avoided, and they should see what can be done. Like if they find out something, if they think, if someone like if somebody sit and think what they are doing is good or correct, they will itself understand what is the issue. Then after that, they should write it down in a paper or a notebook, what and all I should change. If they change it itself, like lifestyle changes is the main thing for the PCOS. If they change the lifestyle changes, then it will be helpful. And if they can't, they tried, and if they can't do, they can start our herbal medicines. It will be helpful for them.
तो आई वाज़ जस्ट कमिंग बैक टू दिस टॉपिक, नाउ वी स्पोक अबाउट पीसीओडी, पीसीओएस। सिद्धा, ऐसा क्या है सिद्धा में कि ये जो पीसीओडी, पीसीओएस है, वो पूरी तरह से क्योर हो जाता है? क्योंकि यूजुअली डॉक्टर्स बोलते हैं कि ये कंट्रोल कर सकते हैं, क्योर
Yes.
नहीं होगा।
Yeah, the modern doctors or the dietitian or whomever you can, if they go and ask, they'll tell PCOD is not curable. It's like maintainable or you can control it. But in Siddha system of medicine, like we are not saying just simply, we do have the proof in the ancient text. Even the manuscripts we have, they say if you give this medicine, it will be cured. So I'm not like a new thing. Like I'm not jumping from some planet and I'm not going to give the medicine. I am following the siddhas, like what they say, like what medicine they give in the text. I give the medicine to the patients. So I'm not saying, like I'm not claiming myself. It's a text I
टेक्स्ट दैट
follow,
सेज, यस।
and in that they say it is curable. Then why it is not? See, if the fever is there, you give this medicine, it is getting cured by Siddha medicine also. Even psoriasis like that we take, there is no cure like for that. But in Siddha, we treat the psoriasis, even psoriasis, we give they give the medicine to the psoriatic patients. They get the good result. Likewise, the same thing we give in the PCOD also. That the same medicines I'm giving. So it works. Many patients of mine, they got cured with this. And if you want to try, you can try and see. They can find out the results in the scan. I don't need to tell anything. Just they can get the scan done and they can come for a treatment. And if they can't come directly, they can send the through WhatsApp, and you can they can get the medicine through courier also, wherever they are in the world. Just
Wherever in the world.
yeah, everywhere we send. So just like if they come directly also, we see the reports and their age and the symptoms, and we give the medicine. If they want online consultation also, they can send the reports and they can follow, and they can find the result within 2-3 months easily.
Acha, so the medicine, the duration, what you're saying to cure it is at least 2-3 months or maybe beyond that.
Yes. Like if there's like more than like if they are following some medicines, hormonal pills, then it'll maybe taking time, maybe 5-6 months. But if they didn't just now it started, or if they are having only 3-6,
Nose
yeah,
level and
beginners
all that.
level, it will be like even some patient they got cured within 2 months also. Yeah, I do have the reports, and you can see my testimonials in Google also. Many patient they have got cured.
So, doctor, my next question to you is, आपके लाइफ में ये 15-20 years of you being in Siddha, कोई ऐसा पेशेंट आया है कि वेरी एग्रेशन के साथ द लेडीज कम एंड टोल्ड यू मुझे ये है, मुझे क्योर करना है, क्या करने वाले हो?
Mostly women, they when they get extra hair growth, that is like
They become very conscious.
yeah, they'll be more stressed out actually. That too, some female patient they come before the marriage. Doctor, I have marriage in 6 months, I don't know I should do this, like because I tried any laser treatment, it's not working, what I should do. Then I should tell, like I will tell, like first you take a scan done and come to me, then I'll guide. Then we'll find out that they have the PCOD. They will not, like some women, they don't know the common things also to check what is there inside their body. They don't do, just they take the oral or the tablets,
Tablets
or
or
just
pills or
external treatment, laser treatment, carbon peel, something they do, but they don't check what is there, what is the root cause, they don't check. I have seen some patients like this, they're coming to me like, I have a extra hair growth, I don't know, I'm having a marriage, it's being a big problematic for me. Like because if they shave or if they do laser or waxing also, it will come within 1 week. Yeah, so that was most common things they
common thing
worried
that they
about.
worried
Yes,
about and they
yes,
come to you majorly
yes,
for that.
yes.
अब उसके बाद पता चलता है कि हाँ इनको
Yeah,
पीसीओडी है.
even like those patients, I give medicines. I'll tell like 2-3 months you take the complete like medicine and you see the result. Likewise, whatever I say, it worked. Like it got reduced and they'll feel happy. Mostly, woman is worried about the skin and hair. Mostly, yeah, yes.
Okay, so doctor, I wanted to check with you कि ये obese, pigmentation, and extra hair growth, all these are only symptoms of PCOD या इसके अलावा कुछ और भी हो सकता है?
Actually, these are the common symptoms we can say. First thing is a irregular menstruation. If the irregular menstruation is there, they should be checked out. Some they don't get the external symptoms like extra hair growth, or they'll not be obese, but they'll have the irregular menstruation. For those patients also, you should be done your USG ultrasound, because that is the latest method we do for the yeah, to diagnose, that they can check it done, and they, if they have the problem, they should not go directly to the hormonal medicines. First, they should change, like they should check. The next thing they should do is that they should check the hormonal levels and the HB levels. So, if that also the problem is there, then they should try to change into natural way, and they should try, because everybody doesn't have the patience. Like once they get diagnosed, they think that within the next week or it should be cured. It's not happens like that. How you get the symptoms like that, only gradually only the medicines also works and will change completely. But they in the fast world, what they do, they go for the
They want
hormonal
everything
pills.
very
Yeah,
quick, quick,
yes, yes.
quick.
They do, and they get stuck to it, because they think that, okay, I'm taking the medicine, the menstruation comes, so I'm okay. But they don't understand that is not the natural menstruation. Some patient, even they don't know, sir, just I take this 21 days tablets, but I don't know what tablet is that.
They don't know. अच्छा,
They don't know.
डॉक्टर
Sir,
ने प्रिस्क्राइब कर दिया और ले लिया उन्होंने.
I have in my handbag, I don't know the name, just they give this, They'd ask me to take 21 days. I'm taking the menstruation is regular.
Regular, huh?
Then I will make them understand that it's not the natural menstruation. They are giving the hormonal pills. It will be okay for now, but if you start using this continuously, then it'll be a problem in your future after the marriage. Then we should,
Infertility
yeah,
starts there.
yeah. First, for those kind of patients, first we'll give the medicines to cleanse the body completely, and we'll start giving the oral medicines, the herbal medicines. So once they continue those hormonal pills, what happens is that body will not work like basically like if you give the medicine for if they start example for example I'm saying if they start taking insulin for the example, their natural insulin secretion will be stopped. Body will think that they get more insulin and they'll not stop working also. So likewise same thing happens in the PCOD patient also. They give the hormonal pills, the body, so after that once they start the medicine, after that the body naturally secreting hormones will be completely stopped and they'll be dependent on those medicines.
On those
Yes.
outside,
Yeah.
okay.
Those external medicines, and they will not menstruation like they will not work naturally. Likewise in the thyroid also, those who are suffering from thyroid, like if they go and diagnose, sir, they only give me 25 mg, they'll tell. Just sir, only 25 mg doctor asked me to prescribe. Okay, you go next time you consult, then what they will tell? We'll see. They'll increase the dosage to 50. Then they'll increase to 100. Then 150. Then it will not work also sometimes. What it means that like when it is in the minimal level, you should change your diet, lifestyle, little bit workouts you do, and you change naturally. If you start taking it for any treatment for any hormonals, even the thyroid or insulin or anything, if they start taking the oral support like external support through the unnatural medicine, then it will be a problem in their future. For even the thyroid patient or many women, they get this problem, thyroid they'll tell, and they'll be starting the medicines, but that will be directly impact the fertility also.
Oh,
Because thyroid is a major organ like a gland which supports in fertility, but if they have the thyroid issues and they take the oral pills like oral hormonal pills, then it will be a problem in their future and the thyroid gland will not work properly. And meanwhile the natural they can't secrete the thyroxine, they'll be giving the external medicines. Yes, and they'll increase the dosage, and you'll be like you'll think that it's working, but it is not actually. It is making your body suppressed.
okay. That's actually very interesting. Um, Now, when a couple gets married, जब उनकी शादी होती है, और they conceive, the lady conceives, but then she doesn't want the baby,
Yeah.
or they don't want the baby, and they are like, ठीक है, एक pill ले लेते हैं, हो गया खत्म. After 2-3 years, we'll see. Does that also affect the eggs?
Yeah, normally once they get conceived after the marriage, they some couples they do this mistake that they don't want the baby that time, and they'll take the oral contraceptive pills to get the abortion done. So once they start doing that, even they do multiple of times also. They don't want now, they don't want now, and once they try for natural, they really want the baby. After 3-4 years, they'll plan it and they'll try, but that time they'll not get the baby. Yeah, then they'll come to me, doctor, we did a mistake. Then only they'll recognize, they'll understand that they did a mistake in the past, and they itself will understand, doctor, we did a mistake in the past that we take abortion pills, and 2-3 times we did, and after that we are trying, we are not able to get conceived naturally. What will be the reason? Then if they check the hormones and the egg quality, everything, the female, for the woman, if it's a woman, then the quality of the eggs will be reduced, and for the male also, the sperm count quality and motility will be reduced. Mostly these days, both men and women, they get married in the later ages. Yeah, for the, it's like recently they say 30 years only I'll get married, the female, and the male say they will get married only 35. If this is the situation, the quality of the eggs also will be not there properly, and for the men also there will be a lack of motility, morphology, and the sperm count will be less due to the stress, the age process. Everything will be problematic in the future. So my advice is for the couple is that once you get conceived for the first time, kindly don't get abortion pills or any abortion methods to do abortion. So if you try in the future, it will be a problematic to get conceived naturally.
Does daru and sutta affect the egg as well and the sperm count?
Yeah, surely for both men and women, excessive of anything is bad. That too, basically for smoking. Like smoking is not good for men also, for women also. And for the alcohol, if it's in the limit, it's not a problem. But if it's going in the excess, it will affect the sperm quality and motility morphology also, because it completely damages the metabolism will be slow, and meanwhile it's okay, but the alcohol, if they continuously consuming, it will be a problem for their sleep cycle. Some people, they think I drink daru and I sleep nicely, but it's not the quality of sleep. If you drink the before day and if you get up in the morning, it will not be like you will be sleeping for 12, 16 hours also. Some they sleep for 12 hours also, but they'll feel tired. But if they don't drink the alcohol and if they sleep for 8 hours, 9 hours also, they'll feel fresh. This is the difference. And for the smoking also, like for the woman it will affect the egg quality, and for the men it will affect the sperm count and motility and morphology.
तो डॉक्टर ये भी जानना था कि ये नॉर्मल मेंस्ट्रुअल साइकिल होता क्या है? क्योंकि ज़्यादातर लोगों को नहीं पता कि ये नॉर्मल कैटेगरी में होता क्या है?
Anything before 25 days is not a normal cycle, and after 35 days is not a normal cycle. It should be actually 28-day cycle, but it can be considered like 25 days after is fine and 35 days before is fine. But if it's before 25 days is not normal and after 35 days is not normal. They should actually, if they don't remember, they should download the app, something recent days they get, and they can just note it down and they can see the next month, because mostly they don't remember properly. That is the main reason, like for they get to like confused. Yeah, they have many apps, they use many apps these days, gaming apps, something. But every woman should have noted down the menstruation cycle dates, and they should remember that.
नो दैट्स एक्चुअली अ वेरी इम्पोर्टेंट
Yes,
पॉइंट जो
yes.
आपने बोला, क्योंकि वो बहुत ज़रूरी है हमें अपने मेंस्ट्रुअल साइकिल को ट्रैक करना बहुत ही ज़्यादा इम्पोर्टेंट है।
Because if they go for a consultation also, so if they're coming to me also for the consultation, I'll ask, when was your last menstruation cycle? Before that, 2 months, how was your cycle? So some they don't remember actually. Some they write it down or something, but they it get lost also. Some they come really like that. So my suggestion is that everyone can download the app and they should note it down, and they can, it will be easy task for them.
दैट एक्चुअली रिमाइंड्स मी, मेरी एक सहेली थी स्कूल में और उनका जो था मेंस्ट्रुएशन 1 महीने में 2 बार होता था। आई मीन वी न्यू फॉर द फैक्ट दैट इट इज़ नॉट गुड, बट फिर भी इट्स आई डोंट नो व्हाई वाज़ दैट। उसके बाद आई शिफ्टेड टू अनदर स्कूल तो वो हुआ नहीं एंड आई कुडन्ट चेक विथ हर, बट फिर भी ऐसा क्यों होता है? 1 महीने में 2 बार क्यों मेंस्ट्रुअल
Mostly
साइकिल?
in PCOD, they don't get the cycles properly, and if they get like prolonged menstruation will be there. But it's not like a cyst is not only one kind. Many kind of cysts is there. Dermoid cyst, endometriosis, like ovarian cyst, something like that. So if they have basically like a fibroid or endometriosis, they'll have the continuous bleeding, or it will stop and on and off. Like sometimes some patient they come and they'll tell doctor, 3 days I get the cycle and after 1 week I get it again. Yeah, like that also. So if it's like that, in that cases, they should check completely. The uterus should be checked completely through the scan, and if something there, they should done the, like they should, treatment should be done.
ये एएमएच लेवल होता क्या है? दिस इज़ अ ट्रेंडिंग वर्ड राइट नाउ। एवरी लेडी वांट्स टू नो ये एएमएच है क्या? तो प्लीज़ एलैबोरेट ऑन दैट।
Yeah, once they get married, and if they don't get conceived after a 1 year or 1.5 years, they nowadays they go quickly. Even 6 months, they go for a fertility clinic. Once they go, they'll suggest you to take, first they'll suggest you to take scan, and next thing they'll tell to check the AMH level. AMH level, if it's high, it's good for female, but if it's higher range also, for some patient, like they'll have the PCOD. This is related. Moderate level of AMH level is good, but if it's in a higher range, some they have the PCOD issues. So we should, the AMH levels also, level also that plays a main role. And once the female is like is getting older, like they're going to get menopause, then that time the AMH level will be reduced. Basically, the in younger age the AMH level should be
शुड बी
more.
मोर,
Yeah.
ज़्यादा होना चाहिए, गॉट इट। ओके, इफ एट ऑल अभी जो बच्चे होते हैं, 8 साल की बच्चियाँ, 9 साल की बच्चियाँ, आई नो फॉर द फैक्ट कि लाइफ़स्टाइल चेंजेस की वजह से उन्हें प्यूबर्टी हिट बहुत जल्दी करता है। सो हमें एज़ अ पेरेंट ऐसे कौन से स्टेप्स उठाने चाहिए ताकि वो हम कंट्रोल कर सकें, या हम ऐसे स्टेप्स लें कि वी कैन मेक श्योर दैट पीसीओडी जैसी डिसीज़ उनको ना हो?
First thing, we should check their body weight. If they are obese, some kids these days, they don't eat properly. They think that they eat healthy, but they eat all kind of junk foods, and even we can't eat like that. How they eat also. Some kids, they finish the one chips packet completely also, but if we eat 2 3 pieces also, we'll feel yuck. But they are getting addicted to the those kind of packaged stuffs, and through the advertisement, through the YouTube or something, like through the reels, they get this is good, that is good. They think that some chocolates are good. Those who say in videos, they buy that and eat, but it's completely full of sugary substances, and it's complex, full of chemicals they add. So like that, if it's like some kids are there, we should be advising them, and we should change slowly, and we should start giving them healthy fruits and vegetables, dry fruits, like purana laddus, no, like how we make like natural laddus, like that. Sesame seed laddu is very good for female, like that. Black sesame seeds, yeah, that is very good for female, like kids also. For even it is rich in calcium, it will balance the estrogen levels in the body. This nobody knows. But the black till is very good for to balance the estrogen levels. They can give the, or if it's a girl child, they can follow. And they should be like, if the excessive of weight gain is there, they should add some physical activities in their lifestyle. And if the stress also, some they have stress inside, they don't tell outside, and they just get angry soon. For them, we should advise them. As a parent, we should not like first itself, we should not like go and torture them or something. We should not beat, or we should not shout. In their way, yeah, in their way, we should go. We should understand what is their issues, and we should make them understand how they should eat. And if the cycle also, we should make them understand what is the cycle. Like some kids, they don't tell to their mother if they don't get the if they get the cycle. They think it's something they have problem. Like this patient I have
You
seen.
have?
Yeah,
Acha.
they don't tell, and they once they get it, like if some issues comes, like if it's stain in the, then only they will understand that they have the menstruation. So first, the parent, as a parent mother, they should first speak to the kid. If they are at going to be 10 years, they should start speaking. If you feel like that, if you face something like a light bleeding or something, you should tell me like that. They should advise the kids, and from that they should make them understand how they should follow, how they should eat properly, how to manage stress. Basically, the even the girl or woman or in any age, during the menstruation cycle, they'll have the psychological issues.
Issues,
They'll
correct.
get more
Mood
stress.
swings.
Yeah, mood swings will
बहुत
be there.
ज़्यादा.
So during that time, if they don't feel to go to school, it's better to be in home. That is also a good, because you should go school. No, there's nothing like that. If they feel something like that, they can take rest, and they should understand what is like body, and they should make them understand. Then only they'll be okay. If they don't guide them properly, then they will not tell outside, and they don't know how to
How to
maintain their,
communicate,
yeah,
panic, सब एक
yeah, that
साथ.
too. They should maintain the hygiene also. They should change the pads, everything, and they should maintain the everything health also properly.
Hmm, hmm, hmm. Okay, I know when the puberty hits, it hits really hard.
Yeah.
ठीक है. ओके डॉक्टर, ये जानना था कि पीसीओडी के जो पेशेंट्स होते हैं, पेशेंट्स ने, बट जिन्हें जिन्हें पीसीओडी
Hmm.
होता है, सिर्फ उन्हीं को इनफर्टिलिटी होता है, या देयर आर अदर रीजंस फॉर इनफर्टिलिटी एज वेल?
PCOD is not only the reason for infertility. Like even some patient with PCOD also, they get conceived, and some they get successful in pregnancy also. But mostly, I will not suggest those are PCOD to get conceived immediately, because they should first clear the root cause, because it will be affecting the like womb. If the baby is developing inside, sometimes they'll tell after they'll go for checkup, like 4 5 months. If they go for checkup, they'll tell it'll be an obstruction for the baby to grow. So in rare cases it happens, but I will suggest first to cure PCOD, and then conceive. And there are some reasons also other than PCOD, like endometriosis. Endometriosis is like is a inflammation of the endometriosis, like outer uterus layer. If they have like those kind of things, they'll have a pricking pain and too much of pain and over bleeding like that, and even fibroids, endometriosis, and even dermoids, chocolate cyst. Chocolate cyst is that it'll be coming like bubbles often coming. So it is a challenging this thing. Like chocolate cyst is a more challenging one. So whatever the kind of the cyst is there, when we start giving the medicine like our herbal medicine formulation, whatever the cyst is there, it will first balance the hormones, it will rectify it completely. It is not only treating the symptoms, but it will cleanse the uterus everything completely, so they will not get the problem again.
प्रॉब्लम
Yeah.
अगेन। अच्छा, तो एक बार हो गया, पूरा क्लियर हो
Yes,
गया,
yes.
फिर से वो नहीं
Yeah.
होता। गॉट इट। ओके। तो डॉक्टर, आपके जो जर्नी में ऐसा कोई, आपने बहुत सारे पेशेंट्स देखे होंगे पीसीओडी के, तो उन पेशेंट्स में से कोई ऐसा चैलेंजिंग पेशेंट था कि आपको लगा भाई दिस इज अ लिटिल डिफिकल्ट फॉर मी, बट लेट्स सी, एक चैलेंज ऐसे आपने लिया एंड कंप्लीटली क्योर्ड दैट पर्सन आउट ऑफ इट?
Yeah, so it's not only one patient. Like many have seen like challenging one. The most common thing what I face is that only they'll have one fallopian tube in there. Yeah, because they'll be having an ectopic pregnancy, and they'll cut the one side and only one fallopian tube will be there. For those kind of patient, normally the cycle will be 2 months once only, and their probability for conceiving also 50%, because we should calculate everything, and we should if see, like if the one side is okay, if the one side they have removed, and even the other side also, if they're having any cysts or something obstacles, then it'll be a problem. So like those patients, they have some patient they come with the other side also blocked.
ओह।
Yeah. So in that cases, when we give our medicines, like it'll take time, like 3-4 months, it will take time, but it'll be cleansed out completely. Then they should try, because HCG test, normally they do test this HCG test to check the fallopian tubes, but it is very painful. They inject the dye. Those who come to me, they say, "Doctor, it's very painful. I didn't able to bear it, but what to do? I want to check it done because my gynec say." So some patient they no need to do also, but they do. Some they don't have the fallopian tube block, but some it's like good advanced method. But without checking also, if they start taking our medicines, like it will cleanse even the tubal blockages, and even the cyst also will be removed. So no need to go check like the painful test. No need to be done.
तो ऐसे चैलेंज आपने देखे हैं
Yeah,
अपने
yes,
करियर
yes.
में?
Mostly the fallopian one side fallopian tube is a challenging one. Yes.
तो वो भी प्योर, आई मीन क्योर करके
Yes,
सक्सेसफुली
yes,
यू
yes. Yes, if it's
लेट
one
इट गो?
side, it's present also. If it's healthy, we can do it. And if they have any obstacle in that tube also, we can give our herbal medicines. And after 3-4 months, if they try for conceiving, it will be successful.
मुझे ये फैक्ट बहुत अच्छा लगा कि सिद्धा में साइड इफेक्ट्स नहीं होता है, वरना एलोपैथी में बहुत सारे साइड इफेक्ट्स होते हैं और कहाँ से क्या हो जाता है वो किसी को नहीं पता। ओके, सो डॉक्टर, लास्ट बट नॉट द लीस्ट, आई एम गोना हैव मेनी मोर कॉन्वर्जेशंस विद यू, बट वी आर एट द एंड ऑफ आवर पॉडकास्ट राइट नाउ। तो एक मैसेज जो आपको अपने व्यूअर्स को देना है पीसीओडी के बारे में और कैसे एक हेल्थी लाइफस्टाइल मेंटेन करें, एंड अनदर वन इज home remedies, if at all you could share, the best fruit, the best dry fruit, जो आप बोल रहे थे before we started our podcast, maybe just shed light on that, please.
Yeah, for to maintain a healthy menstruation cycle is mostly, especially for women, is mostly important. Those who have any menstruation issues like irregular menstruation, they should check their HB levels first. Mostly the women, they don't understand, like when their menstruation cycle is irregular, they just start taking the medicine. That should not be done. First they should check their blood works done, then later they can done the scan. If the blood count is less, like that the HB level is less also, some anemic patient, like some anemic person, they will not get the menstruation cycle normally. So if the HB level is less, the best thing is that they can follow the anar, that is pomegranate, they can consume regularly, and the moringa leaves, drumstick leaves. There is a very good iron rich greens. They can take it as soup daily in the afternoon or any time. And ragi is very rich in calcium. They can follow this. And even date syrup is very good. Those who don't want to take sugar more, they can avoid date syrup and they can have the dates alone. If you follow these four things, your HB level will be normal, your calcium level will be normal. Even the ragi is good to strengthen the uterus, and the moringa leaves is good to maintain the HB level. So these four things, I can say it as a superfood for women. So this thing you can include in your daily diets and follow it normally. And those who have PCOD, don't get worried about that. Don't think that nobody is there to help, or you don't have cure for it. In Siddha system of medicine, we do have excellent medicine for that. Our ancient traditional formulation will help you, sure. 3 to 4 months you can continue the medicines and you can see the results.
Thank you very much for your time, doctor, and it was lovely having conversation with you.
Yeah, thank you.
Thank you.